Greetings, fellow humans. Katrina here. Quick disclaimer, I'm a professional, not your professional. Nothing about today should be taken as medical, legal, or otherwise advice. This podcast is purely for education and amusement. That is it. Disclaimer over. So I thought I'd talk today a bit about what I don't know about Pica. If you've never heard of that, there is a whole section in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, that consists of feeding and eating disorders. And pica is one of the first ones listed on there. So I thought I'd go on a little bit about what characterizes feeding and eating disorders, and then we'll get into what pica specifically is. And this is going to be on pages 371, 372, and 373 of that big bright blue book that I really like showing off. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, no affiliation. I'm just a fan. So here we go. Feeding and eating disorders are characterized by a persistent disturbance of eating or eating-related behavior that results in altered consumption or absorption of food that significantly impairs physical health or psychosocial functioning. Diagnostic criteria are provided for pica, rumination disorder, avoidant restrictive food intake disorder, anorexia nervosa, bulimia nervosa, and binge eating disorder. Those are all in this big DSM-5 TR. The diagnostic criteria for anorexia nervosa, bulimia nervosa, and binge eating disorder result in a classification scheme that is mutually exclusive, so that during a single episode, only one of these diagnoses can be assigned. The rationale for this approach is that despite a number of common psychological and behavioral features, the disorders differ substantially in clinical course outcome and treatment needs. Some individuals with disorders described in this chapter report eating-related symptoms resembling those typically endorsed by individuals with substance use disorders, such as craving and patterns of compulsive use. This resemblance may reflect the involvement of the same neural systems, including those implicated in regulatory self-control and reward, in both groups of disorders. However, the relative combination or contributions of shared distinct factors in the development and perpetuation of eating and substance use disorders remain insufficiently understood. Finally, obesity is not included in the DSM-5 as a mental disorder. Obesity, which is just excess body fat, results from long-term excess of energy intake relative to energy expenditure. A range of genetic, psychological, behavioral, and environmental factors that vary across individuals contribute to the development of obesity. Thus, obesity is not considered a mental disorder. However, there are robust associations between obesity and a number of mental disorders. For example, binge eating disorder, depressive and bipolar disorders, schizophrenia. The side effects of some psychotropic medications contribute importantly to the development of obesity, and obesity may be a risk factor for the development of some mental disorders, for example, depressive disorders. So now we'll dive into exactly what pica is. If you've heard of it, you might think it's just eating things that aren't food. So we'll dive into what the actual diagnostic criteria is. We got A, B, C, and D, and then it goes on with specifiers, and we'll talk about the diagnostic features, the associated features, prevalence, development and course, culture-related diagnostic issues, sex and gender-related issues, diagnostic markers, and a differential diagnosis, as well as a little bit about the comorbidities. So without further introduction, A says persistent eating of non-nutritive, non-food substances over a period of at least 1 month. B, the eating of non-nutritive, non-food substances is inappropriate to the developmental level of the individual. C, the eating behavior is not part of a culturally supported or socially normative practice. D, if the eating behavior occurs in the context of another mental disorder, for example, intellectual developmental disorder or intellectual disability, autism spectrum disorder, schizophrenia, or medical condition, including pregnancy. it is sufficiently severe to warrant additional clinical attention. Now, there's a coding note. It does say in the ICD-10-CM. So let me explain a little bit about what the ICD-10 is. We got the DSM-5-PR for the mental disorders, and then the ICD-10 is like containing all of the diagnoses, to my knowledge. That's the big book of like all of the medical diagnoses. And so it says the ICD-10-CM codes for Pica are F98.3 in children, and then they differentiate that between F50.89 in adults. It does say to specify if in remission. So that means that this can go into remission. It says after a full criteria of Pica for Pica were previously met, the criteria have not been met for a sustained period of time. That sounds a little bit subjective to me, but that sustained period of time would be indicative of remission. So the diagnostic features, it says the essential feature of Pica is eating one or more non-nutritive, non-food substances on a persistent basis over at least 1 month. That's criterion A. That is severe enough to warrant clinical attention. Typical substances ingested tend to vary with age and availability and might include paper, soap, cloth, hair, string, wool, soil, chalk, talcum powder, paint, gum, metal, pebbles, charcoal or coal, ash, clay, starch, or ice. The term non-food is included because the diagnosis of Pica does not apply to the ingestion of diet products of minimal nutritional content. There is typically no aversion to food in general. The eating of non-nutritious, non-food substances may be developmentally inappropriate, that's criterion B, and not part of culturally supportive or socially normative practice, remember criterion C. A minimum of 2 years is suggested for a Pica diagnosis to include developmentally normal mouthing of objects by infants that results in ingestion, right? They say in toys, if the parts are small, keep them away from little kiddos because little tiny babies will just put anything in their mouth. They'll eat absolutely everything. That's not weird. That's just babies. It does go on to say the eating of non-nutritive, non-food substances can be an associated feature of other mental disorders. For example, intellectual developmental disorder or intellectual disability, autism spectrum disorder, or schizophrenia. If the eating behavior occurs exclusively in the context of another mental disorder, a separate diagnosis of Pica should be made only if the eating behavior is sufficiently severe to warrant additional clinical attention, which remember was criterion D. Now, the associated features. Although deficiencies in vitamins and minerals, such as zinc or iron, have been reported, often no specific biological abnormalities are found. In some cases, Pica comes to clinical attention only following general medical complications. For example, mechanical bowel problems, intestinal obstruction, such as that resulting from a bezoar, intestinal perforation, infections such as toxoplasmosis or toxocariasis, I do not know if I'm saying that word right, as a result of ingesting feces or dirt, poisoning such as by ingestion of lead-based paint. Prevalence. On the topic of lead-based paint, I want to say it is if your house is built before the year of 1978. I think that's the cutoff when they absolutely stopped using the lead-based paint. If it's built before then, you might have lead-based paint. Important to look into. Prevalence. Limited data suggests that prevalence of Pica is approximately 5% among school-age children. Roughly 1/3 of pregnant women, especially those with food insecurity, for example, without reliable access to affordable and nutritious food, engage in Pica. Conditions associated with Pica include lack of available food and vitamin deficiency. Development and course. The onset of Pica can occur in childhood, adolescence, or adulthood, although childhood onset is most commonly reported. Pica can occur in otherwise normally developing children, whereas in adults, it appears more likely to occur in the context of intellectual development disorder or other mental disorders. The course of the disorder can be protected and can result in medical emergencies. for example, intestinal obstruction, acute weight loss, poisoning, and the disorder can be potentially fatal depending on the substances ingested. There are some things we're just not supposed to eat. Risk and prognostic factors. Environmental, so neglect, lack of supervision, and developmental delay can increase the risk for this condition. Culture-related diagnostic issues. In some population, the eating of earth or other seemingly non-nutritive substances is believed to be of spiritual, medicinal, or other social value, or may be culturally supported or socially normative practice. Such behavior does not warrant a diagnosis of pica, and that was criterion C. Pica behavior may be prevalent in some cultural groups, but it should not be assumed to be socially normative without further evaluation. Sex and gender-related diagnostic issues. Pica occurs in all genders. The eating of non-nutritive, non-food substances may manifest in pregnancy when specific cravings, for example, chalk or ice, may occur. The diagnosis of pica during pregnancy is appropriate only if such cravings lead to the ingestion of non-nutritive, non-food substances to the extent that the eating of these substances poses potential medical risk. A worldwide meta-analysis showed the prevalence rate of pica to be 28% during pregnancy and or the postpartum period. The diagnostic markers. Abdominal flat plate radiography, ultrasound, and other scanning methods may reveal obstructions related to pica. Blood tests and other laboratory tests can be used to ascertain levels of poisoning or the nature of infection. Functional consequences of pica. Pica can significantly impair physical functioning, but it is rarely the sole cause of impairment in social functioning. Pica often occurs with other disorders associated with impaired social functioning. So the differential diagnosis, and then the comorbidity, and we'll wrap up. Eating of non-nutritive, non-food substances may occur during the course of other mental disorders. We mentioned autism spectrum and schizophrenia, and then Klein-Level syndrome. In any such instance, an additional diagnosis of pica should be given only if the behavior is sufficiently persistent and severe enough to warrant additional clinical attention. It does mention anorexia nervosa. Pica can usually be distinguished from the other feeding and eating disorders by the consumption of non-nutritive, non-food substances. It is important to note, however, that some presentations of anorexia nervosa include ingestion of non-nutritive, non-food substances, such as paper tissues, as a means of attempting to control appetite. In such cases, when the eating of non-nutritive, non-food substances is primarily used as a means of weight control, anorexia nervosa should be the primary diagnosis. Factitious disorder. So some individuals with factitious disorder may intentionally ingest foreign objects as part of the pattern of falsification of physical symptoms. In such instances, there is an element of deception that is consistent with deliberate induction of injury or disease. Non-suicidal self-injury and non-suicidal self-injury behaviors and personality disorders. So some individuals may swallow potentially harmful items, for example, pens, needles, knives, in the context of maladaptive behavior patterns associated with personality disorders or non-suicidal self-injury. Finally, the comorbidity. The disorders most commonly comorbid with pica are autism spectrum disorder and intellectual developmental disorder, intellectual disability, and to a lesser degree, schizophrenia and obsessive compulsive disorder. Pica can be associated with trichotillomania, which is hair pulling disorder, and excoriation, which is skin picking disorder. In comorbid presentations, the hair or skin is typically ingested. Pica can also be associated with avoidant or restrictive food intake disorder, particularly in individuals with strong sensory components to their presentation. When an individual is known to have pica, assessment should include consideration of the possibility of gastrointestinal complication, poisoning, infection, and nutritional deficiency. So I hope you enjoyed today's episode about pica and a little bit about the feeding, feeding and eating disorder. That's the label of the chapter on page 371 of the Diagnostic and Statistical Manual of Mental Disorders text revision, one of my favorite books. So if you like the episode and you want to support the show, click the button on the website. And remember, I appreciate each and every one of you simply for existing.